think we need to approach it as a public health crisis. This is what I would refer to motor vehicle accidents as a public health crisis. Last year alone, we saw 1,698 victims of motor vehicle accidents, and the majority of them are always admitted. So historically, for the past 4 years, from 2019, historically, August, July, the summer holidays, you see the highest number of motor vehicle accidents. Historically, it's clear. From 2019 all the way back, except for the years when we had COVID, we have been seeing the highest number of motor vehicle accidents for the year is during the summer months, especially August. So based on that alone, we know that we have to anticipate that the motor vehicle accident will be high. However, the impact it has on the hospital is significant.
Wow. Also.
Because these accidents, when they happen, they are so severe, leading to critically ill patients, head injury, multiple fractures, lower limb fractures, upper limb fractures, trauma to abdomen, trauma to chest. And so what this means is that some will end up having to be transferred to another institution
outside of St. Andrews
because of the head injury. And if they are not transferred, some of them will have to be admitted, and sometimes for long times, because now they would have had to be admitted to be prepared for surgery. And surgery entails doing surgery on the abdomen, chest, limbs. What this means is that you're going to now be in a bed, admitted, with cost. Every day you're in hospital cost. Even though it's a free, but it costs the government at the end. But not only that, it incurs us using up whatever blood requirements of blood, increased supplies of medication, and so it impacts significantly on the health sector, but not only the health sector, the family. Most of these patients are young persons, below 50. These are now your prime age when you work and do work. So what you would have done is cause a loss of man hours from your work, which you would have now lost production, which in the end will lead to family deprived of basic necessity, but in the end, the loss of production. And I think we need to look at it like this. So first, the impact is significant that you now be taking up another bed for persons who are basically suffering from other illnesses like cancers, who they don't bring it on themselves, they don't know cancer, persons who have medical comorbidities. And so therefore, I really think we need to approach it as a public health crisis. This is what I would refer to motor vehicle as a public health crisis. Last year alone, we saw 1,698 victims of motor vehicle accidents, and the majority of them are always admitted.
1,000 what?
1,698 victims. And that's the trend too, that yearly you see over 1,000 victims suffering from motor vehicle, that secondary to motor vehicle accidents. Remember, this don't include other traumas secondary to stab wounds, falls. This does include, this is just motor vehicle accidents.
GSWs too.
Right. We have had, last year alone, we had 5 massacres, meaning that we would have a motor vehicle accident leading to 26 persons presenting to the hospital one time.